Tim warmed it up more than yours.
It's nice, thank you for that.
Much better.
No. Maybe 20.
So I put it
I don't have to think they will. They have to like it.
I'm going to call to order this Board of Health monthly meeting for Wednesday, December 10th at 5 p.m. Could you call the roll?
Daniel Jenna.
Present.
Jennifer Locke.
Present.
Okay. Approval of the agenda and entertain motions. And I will second that. Any discussion or additions? All those in favor say aye. Aye. Opposed, that carries. Next, we have public participation, approval of minutes of the previous meeting, November 12th, 2025. I'd entertain a motion.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have, next we have public participation. Is there anyone who would wish to speak to the Board of Health this evening? Anyplace? Okay, I don't see public participation. Correspondence from our administrator. And there's no old business, so I'm going to move on to new business. Treasurer's report, Ron.
Yeah, the treasurer's report as of October 2025 is showing cash on hand at the end of October of $9,445,841. The total fund balance exceeded just over $8.6 million, representing 47% of the budget expenditures for the year. We ended the fourth fiscal month with a surplus of $92,475. That was against a budgeted deficit of $275,245. The total annual budget just over $18.2 million. Total revenue just over $4.9 million, or $614,123 under the year-to-date budget, mostly due to grants and contracts not coming in yet and fee-for-services. Total expenditures at $4.8 million is $981,844 under the year-to-date budget, with a mix of personnel being under budget by $262,000, fringe benefits $172,000, and contractual services under the year-to-date budget of $324,000.
Ms. Ron, any questions? Did, since we're about $1 million under budget with, $600,000 under budget with income, was there any significant loss of grants, or is it simply things that have not come in?
The only grants that we lost, and they wouldn't be in there, are relatively small.
Okay.
So we have not lost any big grants. Not good.
Okay.
And I know that we received, I think, almost $250,000 in new grants.
Yeah, I saw the big
Yeah, so,
coordination. Okay. Yeah, and our expenditures are under by $1 million, so to offset that. I'd entertain a motion, put the treasurer's report on file. So moved. Second, any discussion? All those in favor say aye. 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 Opposed, that carries. Next, we have approval of payments to Board of Health appointees, Treasurer Ron Fields for November 2025 services, and Attorney Ruth Wyman for legal services from October 16, 2025 to November 15, 2025. I'd entertain a motion. So moved. A motion, I'll second. Any discussion? All those in favor say aye. 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 Opposed, that carries. Next, we have a review of the monthly credit card statements. Any questions about the credit card? I'd entertain a motion to put it on file.
so moved.
I have a motion, I'll second that. Any discussion? All those in favor say aye. 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 Opposed, that carries. Next, we have approval of check requests. I'm going to take this in omnibus. Would that work?
Yeah, there's no problem with that.
Okay. For CS Construction Group LLC for break room remodel. I almost said break dance remodel. That would be so fun. For break room remodel, just for progress billing for the fiscal 25 audit, IMRF for lump sum payment, Tyler Technologies for Enterprise Permitting and Licensing Annual Fee Year 3, which is this year going forward. Stocks Office Furniture for fiscal year 26. TAS invoice I take an omnibus motion for those. Second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next we have approval of job descriptions. Also an omnibus motion, would that work?
Sure.
Program coordinator in environmental health, which is revised, communicable disease investigator revised, certified medical assistant, which is new, nutrition assistant 1 new, and nutrition assistant 2 new. Want to entertain an omnibus motion? So moved. A motion, I will second it. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have the discussion and approval of the updated retail food program ordinance and enforcement policy 2025-1201. And entertain a motion before discussion. So moved. A motion, and I will second that. We have a motion and a second. I would like to understand the reasoning behind the retail food program ordinance and enforcement policy. Like what was changed and what's the impact?
So what I did was combine the two ordinances. It was hard to refer to two separate ordinances when answering questions. I combined those and simplified the enforcement part, and there were some definitions missing.
Okay. Because it didn't have like a line by line, can you explain what, like in lay terms, what changed in terms of enforcement?
After our recent legislation ruling as far as the board being involved with the hearing, I simplified that as a less step. And so most of that is taken care of with the health authority, which would be Julie,
Okay.
whoever's.
And can you point me to the section on that?
I think there were sections number 7 and 9
Because,
that Ruth had also reviewed for us.
okay. Yeah, I know that we spoke about that, repeat violations. So essentially what would happen is if there were repeat violations, it would go to the administrator, which it does already, and then what happens if they want to appeal the administrator's decision?
The last step would still be the board.
I see, it's just, there's more steps.
There's more steps in it because it really wasn't signed out before our step 1, 2, 3, 4.
Got
Now
it.
it is.
Got it. I
I
see
think it was
fifth
done
time.
in practice that way, but for some reason it wasn't in the actual document. Is that
Okay.
correct?
Yes, so we had to kind of improvise on the last incident, and so this kind of streamlined that.
Okay, yeah, I see it's in, page 81, it's the 5th time repeat violation, so it goes to, then it can go to the public health board at that time.
Yes, and so I kind of moved them down a little bit further and give them more chances.
And there's no changes to penalties?
No,
Okay, it's the same level of penalties as it was
Yes.
before?
But where that will come in is that she's working on getting the fees changed. That will come in a future meeting.
Okay, so you're
Yes.
bringing fee changes?
so I did add a definition for like a reinspection fee that will be in the future to kind of recoup our cost for those
Okay.
cases, follow-ups.
But there's no fee change at this time, and there's no additional enforcement. There's just a definition change and the inspection, and the escalation protocol to the board.
Yes,
Okay.
and there was a definition for like a consultation, kind of spelled it out. So even though we had two ordinances, there were some definitions missing that didn't
Okay.
match up. So
Okay.
those were combined and
Okay.
simplified.
So it makes more sense why, because typically when there's a change, the line item, like it's lined to say what's changed. So I was inclined to say, hey, we need to pump this till we figure out what has changed, but I understand that you're putting two together and you've described what has changed. I would just say in the future, if possible, just so you know, it's much easier. Otherwise, I actually do my homework. So I go and I look at the old ordinance, I look at the new ordinance,
Yeah.
and that's a lot of time. So it's helpful if there's a change, if it's the what is it, track changes, that's the word I'm looking for.
Yeah.
If track changes are used.
But I didn't have one document to do that, so
Got
I
it.
had trouble, I had to copy and paste basically to it, so it all kind of renumbered and
Okay,
I put it kind of in the order that it needed to be.
okay.
So now it'll be easier to edit.
Yes, I hear that. Yeah, and then when the fees happen, if you just can show the old fee and the new fee, then it'll save us time.
No
When you
problem.
bring the fee changes.
Yes,
Thank you for that.
you're welcome.
Any questions?
Not a question, just a comment, like, just from a clarity perspective, I appreciate two getting put into one. It's gonna be much easier for the public, much easier for board members doing that. Whoever is here in the future won't have to dust off an old dusty law degree to figure it out, so.
Well, I was struggling as well to find where it was in what ordinance,
Yeah.
because it didn't match up. So I was like, doing this ordinance for this part of the enforcement and this part for the food code. So this will be one nice enough.
And not that I ever hope that this agency gets there again, but having the rules set out for having
Yes.
the
Yes.
board hearing.
I mean, I feel that that should be a very last,
Oh, yeah, yeah.
effort, and, you know, I think it got kind of pushed a little bit quicker than normal, so
Yeah.
this.
And you
really-
still have those rules that she wrote up, right?
Yes,
Yeah.
yes,
So those will be, that's what it'll be, the hearing rules.
yeah.
I appreciate that.
Yeah. You appreciate
I think that answers my question to your question. Okay.
I'm ready to go on now.
Great, all those in favor signify by saying aye.
Aye.
Opposed, that carries. Next, we have approval of MCH Entryway Artwork and Design Commission Agreement between CUPHD and Jose Vasquez, the artist. I'd entertain a motion.
So moved.
Second, and it looks like it'll be 3,200, and it'll be done before March. And that piece outside is just amazing and beautiful. I hear about it all the time.
I love it. I think everybody loves it.
Yeah.
And the shed.
Yeah, totally.
And the mobile.
Any questions? We did a motion, a second, right?
Yep.
Okay, thanks. All those in favor say aye.
Aye.
Aye. Opposed, that carries. Approval of social media comment policy for CUPHD. I'd entertain a motion.
So moved.
Second, we definitely need a social media policy. Was there not one before?
There was, but not to the extent that this is.
Okay.
We, early on, we were just, you know, asking Fred, can we do this, can we do this, a long time ago. So, yeah, now there's a policy. There's a social media policy, this is a comment policy.
The comment policy,
Yeah.
got it. Okay. Any, seems like a reasonable policy. All those in favor say aye.
Aye.
Opposed, that carries. Approval of project bids, from CS Construction Group LLC for fiscal year 26 refugee center safety improvements. Just take these one at a time. I'd entertain a motion.
So moved.
Motion, and I'll second it. Looks like this one just had a single bid. It must be small.
Yes, it's real small and can't get anybody else to come down and do it.
Okay. Okay, and, yeah, I understand that. It's also my targeting business and it's in Champaign County. All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of project bids from DECA Improvements for fiscal year 26-001 maintenance office remodel. I'd entertain a motion.
So moved.
We have a motion, I'll second, and there's a scoring sheet. DEC, EA was the highest. It seemed to be the lowest cost as well. Any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have Merrill Landscape Services, seasonal pricing all inclusive, my favorite term. I'd entertain a motion.
So moved.
I have a motion, I'll second that. Any discussion?
They had an excellent buffet.
What's that?
They had an excellent buffet.
What's that?
And they're all inclusive.
Oh, the service, yes. All you can eat.
Mhm.
All you can eat is good.
All you can salt, because there's no additional charge in a nice store.
Yeah.
Oh, but there is.
Just for the record, it's
Very
gonna,
expensive.
yeah.
Correct, but
In the
this
this
new,
one.
with
I
this
know, and
year,
the
they won't-
previously
yeah.
it was,
Yeah.
we were like, what?
Yeah.
Yeah.
This is $6,000 a month through December through March. It's a lot.
It's the salt or whatever they
Yeah.
use, salty stuff.
Is it salt? And then, was there a bid process?
Yes, there's 3 or 4 of them in there.
Oh, okay, right. Okay, there, I found mural. Landscaping services. We have a motion and a second. This is, any discussion? All those in favor say aye. Aye. Opposed, that carries. Pending grants, contracts for the administrator to sign. I will make a motion to have me sign between CUPHD and IDPH overdose fatality team development and implementation for fiscal year 26 in the amount of $40,059.13 for a contract period of September of this year through August of next year between CUPHD and IDPH Community Network Anchors for $100,000 for the admin division from October of this year through June of next year, and CUPHD and Illinois Children's Healthcare Foundation, CUPHD Pathways to Oral Health for Women, Infants, and Children for $40,000 in women, WHP, which I all of a sudden have pretty far, I can't remember what it's for. Thank you. For January of this next year through December of the year after 2027. That's my motion.
Second.
A motion, a second, any discussion? All those in favor say aye. Aye. Opposed, that carries. And then I'm gonna make a motion to go into closed meeting pursuant to the Open Meetings Act 5 ILCS 120/2C1 to discuss the appointment, employment, compensation, discipline, performance, or dismissal of specific employees of the public body or legal counsel for the public body, including hearing testimony on a complaint lodged against an employee of the public body or against legal counsel for the public body to determine its validity. That is my motion.
Second.
Motion and second, any discussion? All those in favor say
Can you
aye.
do a roll call?
Oh, sorry, roll call, yes, roll call.
Danielle Chenoweth?
Yes.
Jennifer Black?
Yes.
Great, we'll go into closed session then.
Are you telling me that's Sweet 7's panel